Hello guys, my name is Edwin Wayne. I'm one of the third-year radiology residents and currently a chief resident. So I'll just be talking to you guys a little bit about benefits at Schroeder Hospital. So here is a breakdown of the salary per PGY year. It's pretty standard for uh, compared to other programs in Chicago, but these salaries are not including the internal moonlighting, which I'll talk about in a little bit. So each resident receive a couple stipends every year. For the educational stipend, it's $1,500. So the residents are free to use this money for anything academic related, including books, laptops, professional memberships such as ACR or RSNA or question banks. It replenishes every year, so if you don't use it, it goes away. So the other thing is food stipend. Each resident gets $211 per pay period, so it adds up to $5,500 per year. That just adds on to every paycheck, which is every 2 weeks. Conference days, each resident gets 5 conference days. So usually residents have to seek out these conferences by themselves. These are also, if you don't use these days, you can lose it. So one thing at Schroeder Hospital is we get a lot of days off. So each year we get 20 vacation days. So it can be used anytime. We do build 1 and 2 week vacations into the resident schedule, but they don't have to take vacation days for those weeks, but they can request any weeks off prior to the year starts. And vacation days will accumulate the next year, but there is a cap of 40 days, so 2 years worth of vacation can be accumulated. Sick days, we get 10 sick days per year, and these sick days also accumulate in the next year, and there's no cap. So we are pretty liberal with the sick days. So if you feel too tired coming to work, you're free to call in a sick day. And if you have an appointment in the morning, you want to take 3 hours in the morning or 4 hours in the afternoon, that's okay too, as long as you're not on a required or covered rotation. And so technically each sick and vacation days counts for 11.2 hours. So if you take 4 3-hour sick days, that's technically 1 sick day. And holidays, so we get all the major holidays off, a total of 11. But there are times when the resident is scheduled for a shift on a holiday, but they will receive a floating holiday, which they can use anytime of their choice. So here is a sample schedule, block schedule for the entire year. As you can see, each PGY year has somewhat different rotations. So the required or covered rotations for our program include Body 1, GI or fluoroscopy, Body 2, nuclear medicine, ED, which is like a after-hour shift, and overnight. So daily schedule, our work day is from 8 a.m. to 4 p.m. We have a noon conference every day, and then we have afternoon conferences at 3 p.m. on Tuesday and Thursdays. So it's the resident's job to help with the list, but we are not responsible to clear up the list for the day. So for example, if there's any cases left, when body CT left when we're on body, you can leave at 4 p.m. still, as long as all the stat cases are finished. So usually we leave at 4 o'clock. So we do a good amount of call at our program, but we don't have any 24-hour calls. All after-hour calls, which is after 8 p.m., are independent. There is an attending remotely if we need help with interpretation or if any questions with difficult cases. We are pretty busy on call reading mostly emergency ED and trauma cases and some inpatient cases as well. We read about 100 studies per 8-hour call shift. So there's different types of calls. So for first and second years, we have a ED weekend call. where the residents work from 10 a.m. to 10 p.m. Saturday or Sunday. We have 4 residents per class, so they're expected to work about 1 weekend day every 2 weeks. So there's 12 weekend ED shifts for first and second years, and the first years usually begin ED called in December. The Fantas or internal moonlighting, which is required, I'll talk about a little bit the next slide. IR call is a home pager call. So if there is a emergent or urgent IR case that they're requesting, you're the first person to contact, and then you, as a resident, you are responsible for organizing the case, let the attending know, and if they need help, you come in to help with the case. So each year does IR call a little differently. You do less IR call as you progress. For R1s, we do 2Q 2 weeks. That doesn't mean, and 2Q 4 weeks, total 4 months. Doesn't mean that you work all 4 months. The Q2 weeks means that you're on call 2 weeks of the 4 weeks, and the Q4 weeks means that you're on call 1 week of the 4 weeks. The nomenclature is a little confusing. R2, you do 1Q2 week and 1Q4 week, total of 2 months. R3, you do 2Q4 or 1Q2, so a total of 1 to 2 months. And R4, you only do 1Q4 week, which is 1 month. Next thing is ED shift. So it's working from 4 p.m. to 12 p.m. So R1, R2s have 2-week blocks of ED shift, and R3, R4 has 1 2-week block of ED shift. So this ED shift takes over the regular day-to-day, so you only come in at 4 and you leave at midnight. And night shift starts in second year, so R2 through R4, we do 1 month of night block per year, broken into 2-week blocks. That's from 11 p.m. to 8 a.m. And we usually have a readout at 8 a.m. with the department chair. We get a wellness day on Mondays after you finish one of the each night block. So you can adjust to being back beyond days on Tuesday. And so these night blocks you have Saturday off. So each resident is responsible to do 4 to 5 random Saturday night shifts throughout in 1 year. So all the after-hour call shifts again is independent. So you're the only person who's in-house. So all the troubleshooting, anything with the department goes through you. So residents have pretty big responsibilities in running the show, which I think is a pretty good experience. So moonlighting, we have required internal moonlighting, which is called Fantas, named after a clinic here at Stroger many years ago. So these shifts are built into the monthly schedule. So it begins early R2 year. So the rate for the moonlighting is $93.75 per hour pre-tax. So this just been increased last year. It used to be around $57. So even though these shifts are built into the schedule, residents are free to switch shifts. A lot of residents get rid of shifts if other people want to pick it up and make a little more money. So overall, there is 20 to 22 weekday shifts and 8 weekend shifts. So on the weekday, it's from 4 p.m. to 11 p.m. But you still have to come in during your regular work hours though. So you have to come in 8 o'clock, do your normal rotation to 4 p.m. and then you start working the moonlighting from 4 p.m. to 11 p.m. So it's a pretty long day, about a 15-hour day. On the weekends, same kind of deal, about a 15-hour day. Come in at 8 a.m., you give at 11 p.m. And on the weekend Fantas and the weekday Fantas, you have somebody there with you for majority of the shift, usually a junior resident. So next thing, dedicated study time for boards. So we get 3 months of study time from March to May before taking boards. So we usually make a schedule so that the residents who are taking boards are put on a easier rotation. So we're still required to work from 8 a.m. to 12 p.m. And then so in the afternoon after conference, we are allowed to study on site. So we just have to be somewhere in the hospital in case anything emergencies happen, um, and then we're just free to study. So the last thing I want to talk about is ESIR, which is the Early Specialization in Interventional Radiology. We have one ESR spot per class. I think it's been filled every single year since we started a few years ago. So we decide, the IR attendings decide who they're picking in the third year. So when ESIR residents are very IR heavy, especially in the third and fourth years. So they do regular diagnostic rotations. They do the regular calls as we do, but in addition, they have a total of 11 blocks of IR, one block of vascular surgery, and one block of trauma ICU built into their schedule. So that's all I have for you guys. I'm sure there are other questions that you guys have, but feel free to ask the residents during the Q&A session, and I hope this is helpful. Thank you.